So with that, we are going to go ahead and get into our next video or presentation today. So the Executive Director for the Drug Prevention, Treatment, and Enforcement, Chairman of the Indiana Commission to Combat Abuse, Senior Advisor to Governor Holcomb will be presenting next on Indiana Next Level Recovery.
Well, thank you so much for having me today. I'm so pleased to be with you. I'm Doug Huntsinger, and I serve as the Executive Director for Drug Prevention, Treatment, and Enforcement. I'm also Chairman of the Indiana Commission to Combat Drug Abuse. As a Senior Advisor to Governor Holcomb and a member of his cabinet, I'm charged with coordinating the state's response to the drug epidemic. From day one of Governor Holcomb's administration, combating the drug epidemic has been one of his top priorities. And while COVID-19 has shifted our course, our mission remains the same. For those with substance use disorder, COVID-19 has presented itself to be an especially scary time. They say the opposite of addiction is not sobriety, but connection. And it's very easy to have been disconnected over the last 4 months. Consider the following. Indiana's statewide 211 call center previously received approximately 1,100 calls on a busy day. During the COVID-19 stay-at-home order, 211 averaged over 25,000 calls a day, and many related to mental health and suicidal thoughts. Our emergency departments have seen a 59% increase in overdose events since this time last year. And we've seen nearly a 60% increase in the administration of naloxone by EMS. In response to rising naloxone administration, Governor Holcomb has dedicated $1 million to fund 25,000 doses of naloxone in partnership with Overdose Lifeline. Already, Overdose Lifeline has distributed more than 2,200 doses of this life-saving medication since the launch of the partnership on May 18th. In conjunction with this announcement, Indiana Medicaid has received approval from CMS that allows for full reimbursement for emergency medical responders who administer naloxone. Indiana is the first state in the nation to pay EMS providers for both the administration of the drug and the medication itself. And beginning in September, every offender with a history of substance use disorder will receive a supply of naloxone upon release from the Department of Correction. The COVID-19 pandemic is creating and exacerbating mental health problems and substance use disorders, resulting in an increased need for crisis intervention and resources for psychological well-being. And our administration is responding. In mid-August, Governor Holcomb announced a partnership between the Indiana Division of Mental Health and Addiction and Mental Health America of Indiana to expand access to peer supports through the Indiana Recovery Network. This will help those with mental health and substance use disorders sustain their recovery through one-on-one connections and relationships. This expansion will result in the addition of at least 40 part and full-time peer recovery specialists at 16 of Indiana's recovery-based organizations. Through this partnership, even Hoosiers in areas lacking resources will gain better access to the recovery supports they need. Also this summer, GMHA launched the Be Well Crisis Helpline, part of Indiana 211, where any Hoosier can call and speak with a trained crisis counselor 24/7 free of charge. These trained crisis counselors are able to listen and provide support at a time when individuals are experiencing elevated stress and anxiety. Already, the helpline has been averaging over 200 calls a week since its launch last month. DMHA also opened 2 opioid treatment programs during the COVID-19 shutdown, helping providers connect with the DEA and the Pharmacy Board to get final approvals while both agencies were closed. This moves us closer to our goal of having every Hoosier within an hour's drive of one of these treatment centers. And the work goes far beyond the state's efforts. Our partner organizations across Indiana's 92 counties have gone virtual to continue providing peer recovery support, community outreach, telemedicine, and naloxone and suicide prevention training. Many groups have worked around the clock over the last several months to expand access to quality care and timely treatment in Indiana's underserved counties. For example, the Affiliated Service Partners in Indiana, better known as ASPN, are using a $2.4 million grant to better serve families who are impacted by substance use disorders in high-need areas. Like I said before, COVID-19 shifted our path, but our mission remains the same, and we continue to make progress. We've witnessed a 138% increase in residential treatment beds since Governor Holcomb took office in 2017. And through a partnership between Open Beds and Indiana 211, more than 1,400 Hoosiers have been referred to treatment services through the digital platform. All across our state, communities have banded together, creating strong local coalitions that are connecting people to care and attacking the drug epidemic. At a state level, we've been helping fund many of these coalitions and providing technical assistance. These coalitions have helped to bring mobile response teams to areas that lack treatment capacity and quick response teams to areas that lack follow-up care. We have 20 hospitals with peers in the emergency department, and they have engaged over 1,500 patients. And we know that 63% of those engaged in some form of treatment following their interaction with a peer. We've launched and funded comprehensive addiction recovery centers, helping communities create a hub and spokes approach. Currently, these comprehensive addiction recovery centers exist in 3 counties: Lake, Marion, and Dearborn. And in May, Fort Wayne was awarded and funded for one of these designations. And the American Legislative Exchange Council recently recognized the program as a model law. In rural Indiana, where resources to combat substance use are lacking, Jim Carroll, the director of the Office of National Drug Control Policy, and his team at the White House have launched the Rural Community Toolbox. The Toolbox is a virtual one-stop shop to connect rural leaders with comprehensive resources to help combat drug addiction in small towns and rural areas across the country. For the 900,000 Hoosiers who live in rural counties across Indiana, where 74% of farmers and farm workers say they've been affected by the opioid epidemic in some way, this is a welcomed asset. We aren't just trying to tackle the symptoms here in Indiana. We're working head-on to help those suffering the most. With more than 80% of those in the criminal justice system having a diagnosable substance use disorder, this is ground zero for helping people restart. Through our strong partnership with our Supreme Court and the leadership of the Chief Justice, we're implementing the sequential intercept model in every county. We're funding startup costs for new drug courts and family courts, and we've addressed underlying mental health issues. At the Department of Correction, we're working to redesign the way we provide educational credits to inmates so they have more incentive to holistically engage in addiction recovery treatment, mental health management, and vocational development, so they can re-enter our communities engaged as neighbors, forever removed from the criminal justice system. We're providing job training and certification to those incarcerated and connecting them to employers upon release. In the last 2 years, we've graduated 3,000 inmates from this program. We're implementing evidence-based treatment in all our DOC facilities, moving from small-scale pilots to full implementation. And we've already lowered our recidivism rate by 4%. We know we can do more to help people avoid returning to jail if we connect them to the care they need while they're there. And we're engaging with our county sheriffs, introducing them to community mental health providers so that no matter when an inmate is released from jail, there's continuity in their treatment. It's working in our pilot programs, so we've partnered with the Indiana Sheriff's Association to invest $4.6 million in implementing evidence-based treatment into more jails across our state over the next year. On the prevention front, we're educating Hoosiers about the impact that substance use has on our families, friends, neighbors. Through FIX, Heartbreak and Hope, Inside Our Opioid Crisis. This exhibit at the Indiana State Museum is open again through February 2021 and incorporates art, data, history, science, storytelling, and technology to help people understand that no matter your circumstances, there is treatment and hope is possible. All of this ties into the treatment infrastructure that we're building, which is designed to connect all Hoosiers to the full continuum of care for any substance use disorder. I'm sharing all of this with you to stress that this administration has not sat by and watched the side effects of COVID-19, but rather we have taken a proactive approach. And if anything, COVID-19 has us working harder than ever to help those with substance use disorder and mental health challenges. I'd urge each of you to visit our Next Level Recovery website and view our August progress report. This 6-page document highlights the steps we've taken statewide under Governor Holcomb's leadership to prevent more people from becoming dependent on illicit substances, help Hoosiers access treatment, and recover from substance use disorder. Combating the drug epidemic continues to be a top priority of our administration. And while we've made progress, we know there is much more work to do. It's important that we equip our rural leaders with best practices and resources to deal with the scourge of drug addiction in their communities. The drug epidemic knows no boundaries. Big cities, small towns, no zip code is immune to this disease. And that's where you come in. With your help, we'll do what we can to help keep people alive, expand timely access to treatment, and prevent others from developing substance use disorders. I thank all of you for your partnership and for all that you are doing to help make our state a better place for all Hoosiers. Thank you so much, and I'd be happy to take your questions.
Thank you. Thank you for that wonderful presentation. Looks like you're joining us. Are you able to hear us, and can we hear you? Can we do an audio check real quick?
Yes, how are you?
Wonderful, thank you. Even though we're probably 2 miles apart, but it's great to see you virtually today. So are there any questions from that presentation? Please put those in the chat window, or please ask those, unmute yourself and ask this now. Give her a couple of minutes in case someone's typing or taking care of that. Well, in the meantime, while people are asking those questions, Dr. Anwar, do you have any questions?
Yes, sure. Thank you so much for your presentation. I had a question. Since we are talking about COVID-19 and the modifications that we've made, we've seen a huge increase in the number of the Narcan events at the EMS calls that we have received. And then there is also some surveys that have shown that in US, the mental health issues are increasing due to the social isolation that has been experienced by the people during this COVID-19. What are the plans that your team has in order to combat some of that? I know you touched upon some of that, but how do you plan to combat with that moving forward, especially in adolescents and early youth? Because most of these Narcan events, as well as the suicidal ideation and mental health problems, have been identified in that age group from 18 to 24 years of age.
Yeah, so absolutely. So the partnership we have with Overdose Lifeline is so important in ensuring that naloxone is accessible to anyone and everyone. So if any group out there or any individual needs naloxone, I urge you to go to Overdose Lifeline's website and they will mail it out. We have committed $1 million and we have committed past that to ensure that during this time where we are seeing elevated naloxone usage, that it's going to be accessible moving forward. That's first and foremost to ensure that there's that access to that life-saving medication. But also, we've just recently received Medicaid approval for naloxone. So the ability for EMS and for our emergency responders, police officers to receive naloxone or to be able to access it has greatly increased with those additional payer sources. You mentioned the mental health aspect of this, and we have seen an increase in mental health events. We have worked with 211 for that immediate access. So anyone who needs crisis counseling, we have worked to have crisis counselors there 24/7 free of charge at just by calling 211. But most importantly, the work that we have done, COVID has sped up some of the different programs that we're working on, specifically the recovery hubs. If you sort of look at the work that we've done, we started with naloxone, ensuring that people were able to access that medication immediately. And then it moved into gathering the resources on the Be Well Indiana website. And then the crisis counseling. The last piece of that was really that network of the 16 recovery agencies around the state to begin to really professionalize recovery in a formal sense where there is a payer source for it like we do for many other sources. So the work that we have to do next is to begin to formalize across all of those regions the processes and those connections, so that no matter where you are in the state, it doesn't matter what agency, recovery agency you go to, it's going to be just like going to one of our primary care clinics or our community mental health centers. A lot more formalized and having a lot more formal connections between those groups and the other partners that are part of those networks.
Thank you. And then you touched upon the recovery piece of it. The peer recovery coaches, their services are now reimbursable in Indiana. However, when we talk with our clinical partners or hospitals, they do mention that the reimbursement is not at a level that is sustainable for them to have these people employed for these positions. So do you have any plans in addressing that just from the policy perspective? Because as we are looking, more and more evidence is coming out supporting the use of the peer recovery coaches and specialists in the realm of recovery and long-term recovery specifically.
Yeah, the data around peer recovery specialists is phenomenal. We know that in our emergency departments that you are much more likely to enter into some form of treatment if you have an interaction with a peer. So it is extremely important to our strategy that peer recovery coaches not only be in every a sort of acute care setting or emergency department, but also in our jails and other places where we interact with people who have substance use disorder. So Medicaid sets those rates, but we've been continuing to have conversations with them. But that's not the only barrier. There are employment. Many times these peer recovery coaches, they have difficult past, and they have they may have a criminal history. And so there's also barriers to their employment with some of these organizations. We worked with some of the largest hospital networks in the state to change the way that they hire people to allow for some of these people who have different backgrounds to work in our emergency departments. So the billing rate, while it's an issue, we also know that there are many other issues, and especially during this time, it's also really important that we remember that the self-care that needs to happen for our peer recovery coaches. I know, just for myself, we were actually just talking how we're sort of exhausted by COVID these days, and I know that that takes a toll on all of us, but then throw in those people who are now talking to people who are helping in our peer recovery settings. We got to make sure they're taking care of themselves, because the last thing we want is this great workforce to have additional issues.
Wonderful. Well, thank you so much for joining us today. I know you'll be part of our next two events for our other two. For Harrison County and for Wayne and Fayette County. So we look forward to speaking with you over the next 2 weeks. So thank you for joining us today.
Thanks for having me.
Well, thank you, Mr. Huntsinger. I see that you're with us today, so thank you for that presentation. We'd like to open up the floor to any questions from any of the people here, but we do have a couple prepared for you, though. So I'm going to go ahead and ask one real quick. So we had earlier on Judge Paul Freed, who's with the Superior Court in Fayette County, and he was talking about some of the new programs and initiatives that he was leading throughout his court. And he was mentioning funding as a barrier to some of the initiatives he wants to start. But we also saw in your presentation the investment that your office is making over the 2020 year. Just wondering if there's an update of if there's more funds available to be awarded, or if all those funds have been exhausted for the year, or, and if we think there'd be more funds in 2021.
Absolutely, and thanks so much for having me. The money that we have allotted for the funding of courts, we have given to the Indiana Supreme Court Administration, and they're the ones that administer those programs. We do plan to put an additional $1 million in this year. I know the courts have been a little taxed just trying to get the courts back open. But they are committed to continuing to support more family and drug courts.
Wonderful, wonderful. And then you were also talking about the expansion of treatment programs in the jails, both funding and then policy-wise. What's the status on some of those initiatives as well?
Yeah, so actually I was with DMHA yesterday, and we were going over some of the billing that has been taking place. It's really exciting. We have 12 counties that are currently providing this treatment in their facilities with outside, these are outside entities that are providing the treatment so that there's that continuity in people's treatment when they exit the jails. So we currently have 12 sheriffs that are involved in the program. But we're open to all 91 jails joining so that we can do our best to help those when they're likely at a point in their lives, which is a rock bottom.
Wonderful. Well, we're very excited to hear all the efforts of your office, and we thank you for all the efforts you've done for our state. We know we have a long road ahead of us, but we also know that we're always better, stronger together working forward. Is there any questions from our audience or anything in the chat window that people would like to ask for Mr. Huntsinger?
I think there is one question that I see in the chat. Are there other counties that do not have drug codes looking to be put in place? Or is there any guidelines that they need to follow in order to become eligible or get those funds? I know you mentioned that you've already given out those funds, but are there any guidelines which can be accessed?
Yeah, so again, all of that's run by the Indiana Supreme Court Administration. We have over 100 specialty courts in Indiana, everything from veterans courts to drug courts to family courts. But most importantly, those courts are all regulated by the Supreme Court Administration. They have to meet national requirements in order to, or national standards to operate. So there's a great consistency in our judicial system when it comes to whether you're in a drug court in Hendricks County or you're in one in Wayne. There is going to be, they're going to look and feel very, very similar.
Wonderful.
Thank you.
Thank you so much. Any other questions, or are there any other remarks you'd like to make? I know we recorded this a couple of weeks ago, and things are very fluid in today's environment, especially with COVID. Any new updates you'd like to share?
You know, no, surprisingly, while we did that a couple of weeks ago, it has been, it's still holding. The numbers are still holding. They are not, they're not great, but there's a lot of hope. We know that the Indiana Recovery Network that we launched about a month ago has already served 2,000 people in those 16 regions. And so couldn't be happier with the progress that's being made despite the additional challenges this year.
Well, thank you so much for joining us today. If anyone else have questions, we can definitely share this with Mr. Huntsinger, either through the chat throughout today or privately afterwards as well. And we look forward to seeing you next week for our final session with Harrison County.
Absolutely. Thanks so much for having me.
Thank you.
Thank you.
Well, thank you, Mr. Huntsinger, for being with us today. Can we do a quick audio check to make sure we work?
Yeah, thanks so much. It's good to see you guys again.
Good to see you. You've also been with us for all three, and we first off want to thank you for taking the time out of your busy schedule to be with us for these events and participating with us. So at this time, we'd like to open up the floor for any questions for our guests today, or you can be typing this into the chat window. Or Dr. Anwar, do you have any questions?
I had one question from you, Doug. I always have questions for everyone. We actually received a question through one of our avenues for receiving the questions is there any, I wouldn't say state-specific funding, but if there is any funding that is associated with helping out with the malpractice insurance when it comes to retired physicians who have the MAT waiver and want to participate and help, but don't have the resources to do so?
I will check with our Division of Mental Health and Addiction on that. I know that early on when there was an extreme shortage of data waivered doctors, that there were a number of different programs to get retired doctors or to get doctors waivered. I'm not sure that I've heard of one that takes care of that malpractice insurance, but I'll check with the team over there and let you know one way or the other.
Thank you. We would really appreciate that.
Mm-hmm.
Do we have any questions from
So no questions have come in yet, but I know last week I kind of said, hey, are there any new updates? And there's a meeting the day before. So, are there any new updates since last week or anything else that you want to highlight that you have for today's audience?
Yeah, absolutely. So the updates aren't good updates. In fact, the information that where we talk about overdose events in the emergency department, we've actually seen a 79% increase. And then we've also seen a 63% increase in naloxone being administered by EMS. So as I mentioned, we have dedicated $1 million to increase the use of naloxone. And so if anybody needs naloxone, please contact overdoselifeline.org and request a dose or doses, depending on the size of the organization. But we continue to see our numbers, going in the wrong direction. And at this point, we're still in that sort of crisis phase where we continue to see the impact of COVID. Our hope is that soon we'll be able to really turn the corner and begin to see a lot of those numbers going back to where we were. But we know that's going to take getting people back to work and in some cases getting kids out of the house and back to school. So we know the stresses that are going on in people's lives right now. If you have a substance use disorder, it's being exacerbated. So we have every program that we put out there, our crisis counselors, our recovery supports, all geared toward creating those one-on-one connections. And so our hope is that people with substance use disorder will take advantage of those, and hopefully that will be able to help them through this really difficult time right now.
Well, and we recognize we've heard a lot throughout these events of kind of pre-COVID, post-COVID, and COVID definitely has not done any favors to this crisis. If anything, it's gasoline on the fire, unfortunately. So any other questions from our audience? Checking to make sure. It doesn't look like we have. Well, thank you so much for...
Cody, I have one question, Cody, that came to me via email. Do you see financial barriers and available treatment centers available in rural areas?
Yeah, so one of the biggest, ways that we tore down that financial barrier was Medicaid being able to pay for substance use disorder treatment. That allowed for 1.6 million Hoosiers to access treatment that they were previously doing cash pay for. So that's been a huge step in breaking down barriers. We still have ways to go in having parity across our urban and rural areas. People in rural areas still often have to travel to more populated places to receive treatment. So we've still got a ways to go, but there have been a number of treatment centers that have opened. There was one that I toured in Henryville. And so they're starting to pop up. I mean, as we all know, rural Indiana is no less impacted by substance use disorder than our urban areas. So we're starting to see more facilities in rural areas, but there's still more work to do.
We did got a couple questions coming into the chat. One is, our advanced practice registered nurses, or APRNs, are they able to conduct virtual visits for MAT care?
I don't think so. I know nurse practitioners can under the care of a doctor, but I don't know that our APRNs are able to. But I will check with our I'll check with our team and get back to you on both those issues.
Thank you. And we can follow up with individuals as they come in. We also got another question is, how can you get started with an outreach program or community family training when there isn't one in your area?
Yeah, so the best way is to connect with one of those organizations that is already in another community. And so when we talk about families, there's the parents of addicted loved ones, and when we talk about our outreach or our recovery networks, or even just our coalitions across many different communities, whether it's Columbus or in Clark County or Dearborn, there are a number of organizations that you could model the work that you want to do in your community off of.
And then the last question, due to time, but another question from Sherry. Is there any funding available to support salaries for leaders or staff of small recovery organizations, rural recovery organizations?
Well, so the Indiana Recovery Network would be a great place to start. We just provided them funding to do the 16 organizations across the state. They are continually expanding, and their goal is to have a recovery organization in every county, or a physical location in every county for someone to go to. So Indiana Recovery Network, they're doing amazing work in connecting not just the organizations working in recovery, but connecting our jails and treatment centers and all sorts of other recovery-related housing, recovery-related aspects, and connecting those together. So I would reach out to them first.
Wonderful. Well, thank you so much, Doug, for being with us. We hate to cut our time short, but we want to stay on the agenda. So thank you so much.
Hey, thank you.
And we'll definitely be in touch as other questions come in, and then also with some of the answers that are pending. So thank you so much.
Absolutely. Thank you.